Welcome, everyone. I'm here with Diane Parker, the Good Grief Coach. And we just wanted to share a conversation around a topic that's been coming up a lot in conversations that I've had with other people. And that is the connection between grief and physical symptoms. When you're not feeling absolutely yourself, but all the tests come back normal, nothing indicates that you have anything wrong with you. And so I would love for Di to come and share her perspective on this.
Oh, for sure. Grief, unresolved grief, that we carry that in our bodies, and it is often misdiagnosed by doctors because what happened to you may have happened years ago, and they only look to see what's just been happening now, and you may not even make that physical sort of mental link to that situation. And so they're dealing with the depression, the anxiety, or the stress that you've presented with at that time.
Yeah.
And trouble is, that's not going to help the situation because we carry grief deep within us in our bodies. And it can show up in so many things because if we don't know to talk about it, let's start at the top. You can have issues around your jaw, your teeth, your throat, because in some ways you're not speaking your truth, though you may not
Wow.
realize that's what you need to speak. Then you possibly then are swallowing things down inside. So you could then, especially women that, carry the energy here because we're very heart facing people and we're nurturers and all the rest of it. And when we're going through stuff like this, we can carry that very much so in here, which can, help some of the situations be understood when we have an awful lot of women having breast cancers and stuff like that. And then we drop down into the stomach, where we have IBS, we have Crohn's. We're going to say swimming around there because it's the gut. And after obviously talking with you in the microbiome and all of it, that's the way I see it now. But that can cause those sort of issues, bloatedness, and then obviously then we're dropping down into the bowel and not being able to pass this stuff through. And then the body itself, which is, it's an area that I'm working on at the moment, which is there's a saying that dimpled effect that we have and carry around our tummies and our bottom and our thighs is all unresolved tears. I don't know if you
Wow.
that one.
I've not heard that one.
And so, again, it's like looking at that to say, right, what else is there? We're all layers of something. And it's just kind of like having that space with somebody like yourself or myself to go guided through all unresolved grief. You may not realize that it's there.
Yeah.
Because we're taught an awful lot to have that British stiff upper lip, to be strong, to you've got this type of thing. And actually, having experienced losing my husband, it's the last thing you need.
Mm.
And anybody saying to you, I know how you feel. No, you don't. It's a unique experience to us all. And and you don't appreciate when people actually say to you, be strong, the impact that that actually has on you. It's more pressure when you actually had in my case, I had a wonderful nurse that reached out and touched my knee. I call it the empathy knee. It was like a button. Tears came. Telling me and giving me permission, you do not need to be strong anymore.
Wow.
And that was so she touched my knee. It was a physical response, if you can think of it that way. And the energy came back up through to me to allow me to have those tears. And then what triggers the hormones then. You get the oxytocin, and when we all feel good after a good cry, don't we? All of those things will start to come on board for us to support us when we actually find the courage to say, okay, this isn't working. I need to look to see what else it is. And if it's something I'm storing within me, I need to address it.
Yeah, I love what you shared there, that it was an energy that came up
Yeah.
because what people don't realize, emotions are energy,
Mm.
emotion.
Yeah.
And so when you store it inside, and imagine just like you said, the dimples, the cellulite, the things people do to get rid of that physically, liposuction and the trauma you put the body through, but it could be as simple as the stored emotions there. You haven't let them be that energy go into motion.
Mm.
And
I
so,
read a story too, rather, sorry, of a heart surgeon in America would not do surgery on somebody until they had actually dealt with their issues. He didn't want to put a good heart that he's got from somebody into somebody for them to still live that life with the issues that they were in. That's just
so like transplants.
like a transplant patient, because that's key at the moment over here on the Isle of Man, because we've just gone from a an opt in to an opt out system. So it's that's on my mind at the moment. So that's just popped in that actually you need to address what's going on in your life, in your body, because all of these organs are reacting to through energy that we're transmitting through.
Yeah, it's interesting you shared that because I was reading a study recently, and that's exactly what it shows that in transplants, the person receiving the transplanted organ feels a change in emotions, that even memories start to come through that are not theirs. But
Wow.
imagine all of that energy, all of those memories. And it's not to scare somebody from having a transplant, but it's just showing the power of
Yeah,
those emotions stored inside of our organs.
exactly. And what we're doing to ourselves by doing this. So it can feel uncomfortable at times as well, because we've shared a lot to strip away and say, right, but when you're triggered by something, pay attention, don't be frightened, reach out and speak to a coach, because we can help you work what's behind that trigger. And if it's something, I mean, an awful lot of people, especially when they're grieving, um, will try and comfort themselves, because that's what we're taught to do as we're kids. That the mother comes running in because the child's crying with a biscuit, saying, "Here, this will make you feel better," and it stopped that grieving process, because the child thinks, "Okay, higher authority has told me that this is going to make me feel better." So the child eats biscuit, but still it's interrupted and it feels different, not better. But because of this impact, it can result in then us looking for food to comfort ourselves later on, or looking for that other thing to replace before we deal with the emotion of grief. Um, so you can imagine people comfort eating. I mean, what do we say? Oh, do you want a cup of tea? Or do you want a
Yeah.
drink? And we know, well, from myself, I was drinking wine every night after I lost my husband, and it wasn't until it was about, honestly, about 6 weeks, and I kind of like, this doesn't even taste nice anymore, but it used to make me feel good, so I'm still trying it. But when I woke up to that fact and thought, right, okay, stop, no more, only with your girlfriends, and that's what I did to break that habit, because I realized that wasn't helping me. It wasn't
Mm.
helping me get to the root cause of the issue. And it wasn't until I did the grief training that I managed to do that. So think about what you're eating, why you're eating it. And I like the way you teach me to think, here's what I'm going to eat, going to nourish my body, and work from there.
What, in your experience, are some of the way people comfort themselves? Because eating is the sort of common known thing, but maybe somebody's comforting themselves and they haven't even realized it.
Binge watching, on Netflix or something like that, just getting yourself lost in something. You're not really registering what it is, but in that zone of watching it. Over exercising,
Mm.
that's also another sign of it. Be trying to like run away from your troubles. Going out partying every night, thinking I'm fine, I'm gonna, I'm strong, I can do this. You will crash and burn. I've seen that happen, sadly. People could even go out looking for other relationships if it's been a relationship that's broken down. They might just go out and have more partners than they perhaps would have even thought of, because they're trying to make themselves feel good.
Yeah.
So those are some of the things that you can be doing, or you can get yourself lost in your work. So you're keeping yourself distracted and busy.
Yeah.
Um, you could find yourself completely decorating the house. I did that.
Yeah.
I got I set to and It's kind of like in my father said, "Oh, look who's trying to make the house her own," which kind of hurt because I'm still in that first few grow, but we hated this wallpaper. So I just, one day I just, right, I've had enough and I'm going to paint this. But when we're doing stuff like that, how much of it are you doing? So if it's like you're just freshening a room, fine. But if you find yourself attacking all of the house, then ask yourself why.
What about on the other spectrum? You've talked about like getting yourself busy doing things. What about completely shutting down and
Yeah.
isolating?
A lot of people believe they have to grieve alone
Mm.
because that's what they've seen. Because we're never really taught how to do grief. We just observe. So if your parents or guardians used to take themselves off to cry or to deal with their emotions, they're not teaching you how to do that, how to cry. They're teaching you that that's what you do. There's a great story in the book that I work from explaining this because this, as a young child, his grandfather died. So the message went through to school that his grandfather had died. Child was taken out of the class where he was getting comforted by his friends to sit in a room on his own until the suitable parent came to get him.
Mm.
When he got there, he wanted to run in and give his mum a hug, and some other relatives said, "No, no, go and sit in your room. Your mum just needs a bit of space at the moment." And all he wanted to do was give his mother a hug.
Wow.
So he ended up sitting in his room with all these feelings, with no one to comfort him, thinking, "Well, this is what how you do grief," which made him an isolated person for the rest of his life. And when you end up having a traumatic event like when I lost Andrew, I know that there was what I would call the start of a depression spiral in the grieving when before I really understood what was happening. But because I did NLP coaching, I could talk myself out of it.
Yeah.
I noticed how it was making me feel and I could shift myself to do something to shift that energy. Um, but I could between those two things, I can see how this could all lead to an isolation for somebody, depression, and the it could end up chronic because they've let themselves go down that spiral too deeply.
Yeah. Now, we've spoken a lot about grief when somebody passes away.
Mm,
Something I learned from you because I had this impression of grief that it was just that. Exactly like you said, my experience of grief was when somebody passes away. And
yeah,
then I had my version of
yeah,
grieving.
yeah,
But what I learned from you is there's a whole
yeah,
different
yeah,
definition and world
yeah,
around grief.
yeah. Let's keep it simple. When we have a change in life, any kind of change, that can be a loss. Now, think about it. If you, for example, were made redundant, that's an obvious thing to say it's a loss. And we grieve all of our losses. It's just how attached we are to that loss as to how much we grieve. Because remember, we're all unique, so there's no comparing to anybody else. Um, but when you've got yourself in a situation like you and I were talking about this week about certain bits of my what I'm doing that I want to change. So I have to look at that from the perspective of, well, why haven't I changed that up to now? And you can be in grief because you're stuck where you are, having not made those changes.
Right.
But we can kind of bounce off going, oh, not this again. Why am I still here? That can feel like that is another element of loss. Then you're grieving that, oh, this is not the image I had for myself this time last year.
Yeah.
What did I do wrong? And then you can start doing all of that instead of like you and I were talking about. It's like, right, back to the basics here. Is what you're going to eat going to feed your soul, nourish your body, blah 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 blah. And then you can reflect on that instead of beating yourself over with it, which I do tend to do. I'll hands up to that. If you can catch yourself and think, okay, what changes have happened in my life I haven't addressed? Have I moved house that I didn't actually want to move from? Has a relationship broken down that I
Mm.
You know, your hopes, dreams, and expectations when you meet somebody is how something is going to be. Did it work out that way? Um, are you stuck in a job you want to move out of? How are you managing that? How are you comforting yourself through that? And simple as you had to cancel a holiday because something
Mm.
happened. That there's an element of grief around that.
I see it a lot. Well, after speaking with you, I learned that a lot of patients, when they get a diagnosis,
Yeah,
they have an operation, it's a big change. As you say, the hopes, dreams, and expectations of where they thought they would be in life, nobody expects that they're going to get an illness or have to go under a major operation.
yeah, yeah.
And so that is actually a grieving process.
Yes.
It's the
Yeah.
emotion of grief. It's not a, okay, you've had the operation, now get on with life. There's still that process and all of the things that need to
Well,
keep
yeah,
coming
look
up.
at if you look at it that is a change. It's a significant change if you've had a part of your body removed that you perhaps, I mean, an appendix, the doctor can say, well, you didn't really need that anymore. That's just gone. I mean, when I had one of my kids, the first one probably, I said to the gynecologist because I had cesareans. When can you take out anything else while you're there that I don't need? Because I don't want to go through this again. But I mean, even that, you're carrying this child in your stomach for 9 months. It's growing. You're bonding with it. You're playing with its feet. Or was that just me? And then it's kind of taken from you. It was taken from me as opposed to me helping it into this world. The actual giving birth was kind of a loss, even
Mm.
though obviously I was lucky enough to have the baby. But
Yeah.
the way you think you should be doing something and having to let go of that as well. Yeah, that's interesting, isn't it? I talk about grief is not a process because I talk about it being the emotion because I want to make sure people understand that and that we grieve, like I said before, depending on how attached we are to the loss that we've experienced. So if you've lost your appendix, you may not be that bothered. You're quite relieved you got through the operation. Thank goodness for that. Like, let's make the next holiday plans where we're good to go. If you've lost something more sincere, serious like a kidney or, part of your liver's been taken away, I mean, that's a big impact in your life, or even your gallbladder. You've gone through all that trauma and pain beforehand. So one part of you is quite glad you're not in that pain anymore, but you're still dealing with, oh, now I'm limited. Perhaps I'm on some drugs to keep me going, even though you and I would look for alternatives and, this kind of thing. To even those that lose a leg or a hand or an arm,
Mm.
brain still thinks it's there for quite some time, doesn't
Yeah.
it? Until, but I ended up doing an Ironman because of people like that. I was looking at them thinking, Jesus, if you can do that, so can I. I can get I can get on with this race as well. Um, I mean, oh golly, if if you've got that in you to do that, I can certainly do it. It's interesting to sit and think, how am I feeling? Why do I feel this way? What's happened to me in my life that I hadn't given thought to or made a connection to? But because when I do a loss graph with people, that's generally when they've sort of had the re-education, but I'm going and asking them to do that. And perhaps your guests can do that. Sit with a piece of paper and just write out all the losses now they understand what that is to them
Mm.
on a piece of paper. Now I've explained to you, it's not just about a bereavement. How many losses have you had? Could be miscarriages.
Yeah.
Especially in those early stages. Um, doctors do tend, I was very lucky to have a GP that was very uh, empathetic towards me, but an awful lot can go, well, it's just what happens. I did have that said to me by a lady doctor in the hospital. It's just what happens. With the implication, just get on with it.
Yes. That's our culture. It's very, we're rewarded for coping. You're
Yeah,
seen as stronger. If you can cope and deal with it, you're seen as a stronger species, in fact, which actually not
yeah.
true.
No, no. And unfortunately, I had a supportive husband, and I am a crier anyway if I had something like that. So I was, I managed to grieve that. Um, and there are times that's happened since, but deep rooted stuff like that you perhaps have not even thought to
Yeah.
deal with them. Sit, get yourself in a safe space and allow yourself, find somebody to support you. Radha and I are available. Just find somebody to support you while you are looking into this.
Yeah. And that's a great place to bring all of this together is the connection that I bring into this is the nervous system. Our body doesn't like losing anything. And so it will find a way, any unexpressed grief, it's not going to disappear if you don't process it. It's going to redirect, whether it's like you said, the bloating, hormonal imbalance, aches and pains suddenly, flare ups of skin problems, because that nervous system is in hyperdrive, it's in survival mode. And so, from my point of view, the starting point is calm all of that down. And then what you say is then allow, or it will just
Bit,
start to come up.
it's a bit like, when you used to bake cakes with your mum or your gran, and they'd have you shake the bowl of flour. And then eventually these lumps would come to the top when you kind of getting the mix together, and you would sit there and you would pop them.
Yes.
That's the analogy I give people when we're going through this, because I'm still going, we're not complete. There's something always still to show, and oh, I'm triggered by this. There's something to deal with. And it's just that we kind of shake up, we deal with what's there, then we get a period of calm, and then something else might just happen to shake that bowl again, saying, "Oh, well, you need to deal with this now. Is that okay?" And I've just had this happen in the last couple of months. Um, and it's amazing when you know how to do it. It doesn't frighten you so much, or, sometimes you can go, oh, not this again. Um, but you have a different perspective when you've worked with somebody like myself and Radha. You can kind of go, oh, that's interesting. What's behind that then? And then it may be that you need to go and find a financial expert to help you with it because it's a money related issue, but it's still in the nervous system. It's still a
Yes,
loss of some kind that you're dealing with.
exactly.
Yeah.
Well, thank you so much. I know that this is going to be so helpful for anybody and everybody who's listening, because as you say, everybody's experienced some form of loss. So there's a lot of key takeaways. Now, what would be a key takeaway for you if there's one thing that you want to make sure everybody hears? And what would the next steps be for them?
You're not alone unless you choose to be. Reach out and find some support in whatever area you feel that you need help with right now. So whether that is your health and nutrition, whether it's to deal with any grief that you can, as we've been talking, it's triggered you and you've realized that, oh, hang on a minute, yes, that actually did have a big impact on me. It could be something a teacher said to you at school, but it's something you've carried all these years. Go and address it because it's not going to get any better. All you're going to do is not speak your truth like we started with. You're going to swallow it down and it will be carried in your body and affect you in some way. So whether or not it's even arthritis, you're carrying this in your body.
Thank you so much. If somebody wants to learn more about what it is you do or wants to reach out, how can they get in touch with you?
Thanks. They can get in touch through my website, which is www.thegoodgriefcoachiom.com. Or you'll
Thank you.
find me on Facebook or LinkedIn as Di Pocket.
Amazing. And I
Okay.
will pop those in the description below so that everybody can reach you.
Thank you so much. It's been
Thank
great
you
talking
so
today.
much.